interesting with teeth whitening because people often come in and they say to me, I want my teeth to be whiter, but I don't want them to look ridiculous like the people on TV. Can we whiten them?
They actually don't want that.
No, they're like, can we whiten them just a little bit? It's quite a British thing to not want, or maybe even a European thing to not want your teeth very white. And it's interesting how different cultures or different countries have different expectations of what an aesthetic ideal is. The thing with the UK is quite often people want to have work done but not look like they've had anything done, just look like the best version of themselves. Right. And the interesting thing about teeth whitening is that generally teeth will whiten to the white of your eyes. So,
really?
Yeah.
To the white of...
To your eyes. So a good indicator is to look at yourself in the mirror and smile, and then have a look at the colour of your teeth and have a look at the colour of your eyes and see how they compare. People who have super white teeth tend to have porcelain veneers that they've asked to have made.
Oh, so that's
colour.
the Hollywood smile.
Yeah, I mean, you can have really natural looking veneers, and that's my preference for the veneers that I do as well. But teeth will only whiten to the white of your eyes. So I often talk about this episode in Friends that people have seen. There's an episode where Ross, have you seen that? With really white teeth.
It was like luminous.
Yeah, and that's Tipex. Do you know Tipex? You call it white out in America. It's like a thing.
They actually achieve that? That's real.
Yeah, no, I mean it don't put it on your teeth. It's a chemical and it's dangerous for your mouth. But it's like someone Ross had gone and like taken white out and painted it on his teeth and made them super white. Whitening doesn't make teeth.
Basically, your teeth would be the only thing that shines in the dark.
Right, and you see people like that. I just think it looks so strange. So teeth whitening, will make teeth lighter and brighter, but it doesn't make teeth sort of paper white like the whites of your shoes.
So how long does it take to achieve the best results? Is it hours, days, weeks?
So your teeth have a saturation point, at which point they won't get any whiter. And saturation point. And so that saturation point, it depends on how you decide to whiten your teeth. There's two different ways of teeth whitening that I offer. One is home whitening. So you have a bespoke whitening kit made up that fits your mouth, and you wear your whitening gel in your trays. You have whitening gel that we give you, that you pop in your trays. We show you how to do that. And you wear it for 1 hour a day. We ask you to do 1 hour a day, every day, for 2 weeks. So we think 14 applications normally will get you to saturation point. Obviously, there's deviations from the norm. There are people who are starting with whiter teeth who don't need the full 14 days. You have people who are starting with darker teeth who need more than that. But 14 days is a really good average. For some people, it's really difficult to find that time. They're like, how am I going to find 14 days or 14 hours to be able to wear these trays?
I mean, it's just 1 hour. So
it's only 1 hour. Yeah, I guess when you work really long hours, and you can wear them when you're working as well. I know people wear them driving to work. People wear them, going out shopping. But if you felt like in your lifestyle, and people know their own lifestyles, if that would be tricky, then you can come in for an in-surgery whitening. So you lie down, listen to a podcast, watch a film, and I can whiten your teeth for you. But that won't necessarily get you to saturation point, depending where you're starting. You may still need to use your home kit, but maybe just for a few days afterwards.
Just a few days.
Yeah.
As opposed to 2 weeks.
And also, whitening's not permanent. It's not forever. So your teeth will probably, there was a study that was done, and it showed that 85% of patients hadn't gone back to their original color 5 years after whitening. So your teeth probably will never go back to the original color, but they will fade with time, and the level at which they will fade depends on lifestyle. So it depends on tea, coffee, red wine, Asian foods, and no one's asking you to stop all these things, but your teeth may fade, and so whitening needs to be maintained. And optimum maintenance is to pop your trays in for an hour every few months. So just 1 hour, not the whole 14 days, but just 1 hour every few months.
Okay, wow. What about, there's so many people that have yellow teeth.
Yeah.
Why do you think they don't just do it? Like, it's so easy.
I think people worry about the cost, like they're not sure how much it will cost. And so maybe they think, and so maybe they don't ask. Maybe...
Is it an expensive procedure?
I don't think it's massively expensive compared to other procedures that you could have done.
Like £2,000 something.
Oh no, our prices start for bespoke tooth whitening. They start from £485.
Okay.
So yeah,
everybody can afford it.
Yeah, exactly. And there's finance options and the rest of it. So yeah, it's not a massively expensive procedure, especially considering it's the least invasive cosmetic procedure out there. There's no damage caused by it, and it looks good on everyone. Like everyone looks better with whiter teeth. Maybe people don't mind the color of their teeth. They haven't noticed. They haven't realized they can look better. They haven't really thought about it. They're not sure what their options are. They've never asked a dentist. So I think there's lots of reasons. I mean, why do you think some people don't whiten their teeth?
Maybe they're shy. They don't know what to expect, so they don't know. They think they look good the way they are, which might be true as well. But
it could look better. Who doesn't want to look better?
Yeah, I
think everyone looks better with a whiter smile.
Imagine, like, you could probably close more deals if you have a wider smile.
Yeah.
You could probably, like, be more attractive to the other, to your partner as well. So there's, like, so much upside to it.
Yeah, exactly. Why looking better is never a bad thing. It's always a positive thing for human beings.
Maybe people just don't want to try something new. You know, it's like, oh, I've seen myself with this smile all my life, so why should I put something white on it? You know?
Yeah, that's interesting as well. Maybe I don't know why people feel nervous about something that's definitely going to make them look better. Like there's no risk there. It's not like you're gonna.
So everybody should do it. Are there any people that shouldn't do teeth whitening?
As long as you've got good, healthy teeth, obviously the health of your mouth is paramount, and so you have to be dealing with health. There can be some issues, like, for example, crowns, veneers, old restorations won't change colour when you whiten. So if you've got a heavily restored mouth, if you've got a lot of these things in your mouth, then maybe you want to think about whether you're willing to change them when you whiten.
When you say restore, what does that mean?
So like a crown or a veneer or a filling or any of that in the front of your mouth, on your front teeth, then they won't...
Because you whiten all in the front.
Yes, you whiten the front 10 teeth. Those are the ones that are visible. But even if you whitened all your teeth, it's the front ones that would be visible. So if you had a filling on a front tooth, you'd have to, if you whitened, you'd also probably have to change that to a whitened colour. So you have to be prepared to do that.
Okay. All right. Is it very invasive, like with those gels? Can you overdo it?
So if you put too much gel in the trays, it could burn your gums. So we show you very carefully how to do that. And we have these special trays that we have made that mark out the amount that you need. The syringes are used to show how much you need. So it's very rare that anyone would burn their gums. Damage-wise, it's like microscopically, the damage caused by whitening is the same as drinking a can of Coke. And although I'm not a massive advocate of drinking Coke, it's okay. Your anatomy, your enamel changes slightly, but it goes back to what it was within 2 weeks of whitening. So there's no long-term damage to your teeth. I think that's another misconception that people have. There can be some damage caused by these homemade whitening kits. Like, some people say, like, rub strawberries on your teeth, rub bicarbonate of soda on your teeth.
Lemon. They have recipes.
That can be so dangerous because the way that works is you have surface stain on your teeth. Yeah. So over the years, you gather stain from like drinking tea, coffee, red wine. And so when you start to use these abrasive things, you start to remove the stain and the teeth look whiter. But then you keep on abrading away your enamel, and then you're wearing away your own enamel. And actually, the inside of your tooth, your dentine, is yellow. So with time, your teeth become more sensitive. They become more yellow. Your enamel doesn't grow back, and you can develop some real problems. So yeah, if you want to whiten, as with everything, get it done professionally. It's a physical. It's a part of your body that you're dealing with, and really should be done.
So do you do that as well, or you just do veneers?
No, so I do teeth whitening. I've whitened my teeth. I've whitened 99.9% of my patients' teeth. I've whitened all of my friends' and family's teeth. So yeah, most of my patients have teeth whitening. Because it's a no-brainer. If you're coming to me to look better, it's like one of the most obvious things you can do.
All right.
I hope this has cleared up. Some of the questions you were saying where people might not whiten. I hope this has cleared up some of those misconceptions.
Yeah, somebody has to come to them like, you can just whiten your teeth. It's very easy and it's inexpensive.
I hope they can listen to this and be like, oh, is it that straightforward?
They probably just don't know the massive difference that a white smile would make on their face.
Yeah.
So, because like they're looking in the mirror every day, it's like, oh, I look great. But then if you do this procedure, then they look in the mirror and they see like, oh, wow. And like, I look really great.
Yeah.
It's like, and you want to smile more
Yeah.
at people, and you're like, oh, actually, I should have done this years ago. That was my case, by the way.
Yeah. You don't like that until you knew me.
Yeah.
Well, that was really fun. Thanks for asking your questions today, Chris.
No, of course, babe.
I hope, I hope that was useful. So let's go back out to the sun.
All right, let's enjoy our sun.
Yeah. Thanks, guys.
Thank you. Bye.
Bye.